Hello, how you doing? This is Dr. Rehab Director. All right, coming at you today with a short video about customer service. We all know what it's like to have good customer service. We might not be able to explain it in words, but we really know when we don't get good customer service, no matter what you're doing. Um, in healthcare, it's very important to get customer service because I always tell people you could have the best skill set ever clinically, whether you're a doctor, a nurse, a therapist, I don't care. You don't have that good bedside manner, that's what you're worth. Very poor. I don't care what level you're talking about, but we deal with people, and that's what we need to make sure that we're catering to at all
There
times.
might be some challenges
Um,
here and there. Take it one day at a time.
if you are able to provide good customer service, regardless of what the person's dealing with in their life, that whole experience of being in that healthcare environment will be a little bit more positive and at least give them a little bit and give them a better outcome or a better experience during the whole process. Um, so, what are some things of customer service, right? Um, First of all, any customer service interaction needs to leave a positive experience for the resident or their family or whoever that customer is, regardless of whether the need was satisfied or not, or who are customers, right? You're in healthcare, residents only? No. Residents are a big part of our customers, but really it's everybody, depending what your role is. As a therapist, our customers are the doctors, the nurses, the residents, the families, the other facility staff, the CNAs, vendors that we might be interacting with, or other professionals that might come to our facilities to work with our residents. And regardless of your position, the customers are the same. So if you're a doctor, residents, families, therapists, nurses, it's the same group. Anybody who you interact with is a customer. Whether you choose to accept it or not, that's up to you, but that's the reality. So, what are some things or characteristics that allow you to have good customer service? First of all, patience. Patience with the patients, patience with
Don't
everybody.
do it. Don't do it.
Friendliness, big one too. Doesn't matter what your personality is. You work in a service industry, so your personality needs to adapt and match to what's going on at your work. Again, doesn't matter your role. I don't care if you're a doctor, nurse, therapist, CNA. Same goes to you. You like it, fine. If you don't, well, you're probably not very well liked, anyways. But anyways, so friendliness is a big thing. Proactivity, the residents are in your room, they're in a certain area, especially if you're looking at a nursing home environment, a hospital, or as well. They use a call button or call bell to, let somebody know that they need something. Well, guess what? If nobody's checked up on them, they might be thirsty. That's a good idea. If you're a CNA, check up on them every now and then during your shift. Um, if you're a therapist and you're going in there for a particular reason, ask if there's anything else you can do. So being proactive, anticipating behaviors, anticipating needs in all aspects, regardless of your level. If you're a clinician going in there for a specific purpose, making sure that enough sufficient education was provided, all questions were answered. It's proactive. You can't just assume somebody absorbed all the information you gave them. You have to dig for more and find out if they're looking for anything else in particular, as far as information, services, what have you. Um, Understanding what you have to offer, what you can or can't do as a clinician, as a staff member, as an organization. Um, Talked about honesty, admitting when you need to consult with somebody else for more information or to get a better answer. Never lying, never pretending that you have all the information, regardless of what your level is. Um, but definitely um, understanding that you're an advocate for the facility or the organization that you work with. So customer service is important. And if you're working and you don't like the organization, you can't take that out and explain that to the resident. Oh, I can't believe we don't have this, or, I'm tired of this place. Well, if you're that tired, go work somewhere else. Point blank. You can't work at one facility in one place and badmouth them at the same time. All right. So the shoe fits. Wear it. What else? If for some reason what you provide or what you have available is not satisfactory to the resident, try to figure out what it is that why it is that they want whatever it is. Whether it's a specific type of therapy, whether it's a specific type of medication, it's a specific type of procedure, because in their mind they have a certain need that needs to be met, and you might have something else to offer that will still satisfy that need, even though their initial request is not something that you have available. Um, Communication is very important. That goes to say, don't anticipate what somebody's going to say. Let them say it, because you might fill in the blanks and fill them in incorrectly. That nobody likes that. So active listening. Listen to the person, hear what they're saying, look at their body language, look at their gestures, see what they mean. Maybe pay attention to what they're not saying as well. So it's really important to be engaged. You have to make eye contact. You have to stay focused with the resident, whoever that customer is at a time. Uh, Another thing that's important is use professional language, regardless of what level you are in an organization, healthcare organization in particular. There's certain things you should and shouldn't say. You shouldn't get too chummy chummy. There should be a professional line that you can maintain while maintaining good rapport. But obviously, don't use foul language. No, don't use uh, unprofessional language. Just because a person is using unprofessional language or they're maybe cursing, they're the resident, they're a customer. They can say whatever they want. We're getting paid to be there. Okay, we have separate guidelines to follow, and I'm sure HR wouldn't like some of the languages that the resident is using as well. But hey, that's what we're here for. Satisfy the residents. So, professional communication at all times is what I'm saying. Know who your customers are. Know what they expect. Each resident has a specific need. They're there for specific reasons, but you're dealing with people. Just because you have 3 or 4 residents that have the same diagnosis doesn't mean that it's going to present the same way. Doesn't mean that they're going to feel the same way, or that they are going to function the same way, or they're going to deal with it the same way. So guess what? Each person's different, and be aware of that. Yes, there might be some similarities and some things that carry over, but remember, start from a clean slate all the time. It's also a good idea to find out from their perspective what it is that they're looking for in good service. How many times don't we get information from a resident? Oh, I was at the other building and they're horrible. They did this, and that. And, oh, you're much better than the person that was just here yesterday. Oh, I can't stand them. Please don't let me have to work with them anymore. Find out what happened. It's important. If it was something where that person did something inappropriate, there's a chain of command. There's a way to report and communicate these things. A lot of times they just might not be aware of it, but somebody needs to say, hey, you can't do that anymore. All right. So the other thing that goes with that is follow up. If you say you're going to do something, make sure you do it. If you don't do it, make sure you tell them why. Go back and close that circle. It's a circle of trust. If you break it, a promise has been broken. You will not have that interaction as well. Most of the time they'll forgive you, depending what it is, but it's better not to even go there, right? You make a promise, you say you're going to do something. I don't care if you have to write it down. Take a picture, who knows? But make sure you get it done. Or have somebody else follow up for you if you need to. Both positive and negative. Get feedback from them so that you know what you could have done differently. If you did something right and they're happy, let them voice what they were specifically happy about. You might be surprised the reason they're so happy about it. Yay! Might not be the reason you're so happy that you think they should be happy for. Or if things didn't go so well, maybe you thought you did a good job, but they said, well, ask them, what could I have done differently? Get information, probe, find out what it is that occurred. And that way, when you're working with them, or you can relate to somebody else in your team, hopefully team communication, they'll know how to address that issue with them differently. But if not, you can learn from it so that next time you have a situation or a resident like that, you'll be better prepared to fulfill their needs from a customer service perspective, so that you can learn from your mistakes and gradually get better and better and better and better. Yeah. That's what we're supposed to be doing, people. Don't stay stagnant, whatever you're doing. Take it to the next level. If you're get better and better so that you can provide a better clinical service and hopefully in turn also provide better outcomes to the facility. That's what it's about. PDPM. Maybe we'll do a video about that in the future. Again, follow up, close the loop, circle of trust, very important. Now, manage your time wisely. Don't cut down on customer service because you don't got your stuff together. Get your stuff together and have good customer service. At the same time, remember we're dealing with people. Be honest, be real, and be well informed. I don't care what level you are, what your profession is. You work in healthcare, you have to have your clinical stuff down packed. You're good at what you do. That goes a long way too. Like I said, you're dealing with people. So guess what? You're dealing with people, so you have to have good customer service. That's my second thing for customer service in the healthcare environment. Be good at what you do, be good with people, and you'll go a long way. Situational awareness. Well, what's that mean? Well, be aware of what's going on with the resident or the customer when you're in your work environment. It could be a coworker. Coworker looks like they're having a rough day. You want to approach them a certain way. They're still at work, so they should be approachable. But be conscious of that. Maybe they got some bad news, something happened with their family at home. Know how to tread lightly. But of course, it's different with the resident. They're there. They're our consumers. They're our patients. So we have to always be all right. Doesn't matter what happened in your day or at your home. Like they say, stays at the door when you clock in. Easier said than done sometimes, but the reality is what it is. You have to do that. Especially with the residents. They're not there to listen to your problems. They got problems of their own. They're in a facility. I don't think they really care too much about your problems. But regardless, yeah, you have to be aware. Maybe they got some bad news. Maybe they just had a recent procedure done. They have a recent procedure. Maybe they had a recent scan. They don't know the results yet. They could be worried. It's the therapeutic use of self. If you're a therapist, you should know what I'm talking about. If you're another aspect of healthcare, look it up, but I'm sure you can figure it out. Two more things that deal with customer service. First of all is remain calm, stay positive, right? Remain calm is a big one. Regardless of the situation, regardless of how upset the resident or their family might be, you have to stay calm. You guys ever saw that movie Roadhouse with Patrick Swayze? Be nice. I don't care what they do. Be nice. They yell at you, they curse at you. Be nice. Unfortunately, in this setting, you cannot not be nice. You can professionally excuse yourself from the situation, maybe talk to a supervisor to jump in if needed. But obviously, at no point are we to retaliate back verbally and curse them out or say anything inappropriate. The HR standards will be the same regardless of the situation. So when it comes to verbal information, verbal exchange, you always need to be on a high road of it. And the last thing I'll say about customer service is dynamic thinking. What does that mean? Stay on your toes, be proactive, always be, observing the big picture. Look for new solutions. Just because, Jane Doe, John Doe before you couldn't solve an issue that this person has, don't just assume you're going to use the same answer. Well, they try to help you. I can't do anything. No, don't take the easy road. Take a minute or two. Think about what happened. Think about what could have been different and see if you can provide a different solution. Okay? That's how you get answers done. There's been many times, whether it's customer service related or even clinical, somebody says, well, I tried that and yeah, they might have, but maybe they didn't put in as much effort. Or maybe the situation's a little bit different now. Maybe we got the supplies that they were looking for that weren't there before. Maybe you have a different skill set, or maybe just a better personality. Who knows? But whatever. Regardless, give it a try. And it's always nice when you confirm. I think sometimes from a customer service perspective, if everything's already been done and you're confirming it, even though their answer or their specific need hasn't been met, the fact that they see that there's consistency puts them more at ease, because then they feel like, okay, this person, they try to do it, and I guess that it doesn't work that way. Um, Now, most of the time we can fulfill some needs, but sometimes there's things that we can't change. For example, if the person got cut by the insurance, nobody likes that, right? They might ask you, hey, can you talk to the case manager again? Can you talk to the doctor? Can you do this for me? And some people might have done that, right? Hopefully. And you try and then you look, it's been done. You might try again and reach out to maybe one of your contacts, and unfortunately, the insurance is not budging. So in that situation, it's something where even though we couldn't beat the person knows that you tried and you made that second or third effort, and that's what they know. That's that where that customer service is important. They say, well, they weren't able to change that outcome, but they really did their best to try. Now, for most of the things, to be honest, I think that those second and third efforts are usually very fruitful. There's usually that out of the box thinker that figures out a different option or a different need that takes the customer service interaction in that positive direction, and it's a win-win. But even in the ones where it's like a lose-win, we weren't able to change the outcome or change that need, but because of that effort and because of that commitment to trying to help, the customer service rating is still high. Anyways, that's Dr. Rehab Director for you. Remember, go ahead and send me messages or comments and let me know if you want me to address any other specific topic. Either way, please hit that like button, share it, trying to get the subscribers and views up. Thank you. Have a good day.